I'd now like to welcome Genevieve Obarski to the podium for this evening's educational presentation. Genevieve is the Executive Lead, Program Implementation at the Change Foundation. Genevieve joined the Change Foundation in April 2011 to coordinate and implement the quality improvement activities flowing from the Foundation's 2010-13 strategic plan, a plan that she's going to tell us a little bit more about tonight. In addition to providing quality improvement expertise, she supports the Foundation's evaluation framework and is active in stakeholder relations. I understand that Genevieve will be speaking for approximately 20 minutes, maybe 25, and then she will have some time to take some questions. Please join me in welcoming Genevieve Obarski.
Thank you very much. On behalf of our President and CEO, Kathy Fuchs, who's traveling now to a speaking engagement, I want to just say we're delighted to be invited to address you here at the Northumberland Hills Hospital Board of Directors meeting. And thank you to the PATH partners, community members, community press, the Northumberland staff, and Minister Matthews for your attention and listening to the Change Foundation story. Sorry, Stacey.
Okay. Just point to
So
the left.
push the wrong button. Okay. Just a little bit of an overview on the presentation. I'd like to tell you a bit about the Change Foundation and talk about how we got on the path to focusing on patient experience, describe some of the elements of our current strategic plan, talk about the PATH project and patient co-design, and then just talk a little bit about the future state that we're trying to get to. The Change Foundation was endowed by the Ontario Hospital Association in 1996, and we spent about 10 years as a granting agency, focused mostly on local system change, so pockets of money to various groups for small projects that weren't really sort of tied together in a unified agenda. And the Change Foundation was reorganized in 2007 around wanting to have a broader health system focus and sort of corral our efforts into a more unified program. And so now we have evolved into a health policy think tank focused on issues of integration, quality improvement, and patient experience, all of which are integral to the PATH project. Our mandate is to promote, support, and improve health and the delivery of healthcare in Ontario. And we're ably supported in trying to carry out that mandate by our Foundation Board of Directors that you see here. We still have fairly close ties with the Ontario Hospital Association. You'll see Pat Campbell, the President and Chief Executive Officer of the Ontario Hospital Association, is on our board, as well as Marcia Visser, who's the Chair of the Ontario Hospital Association Board, and lots of other members that help us figure out what we can do at the Foundation to make the most leverage on influencing health policy in Ontario. Our CEO likes to call us a small organization with a big mouth. We have only 9 full-time staff. 3 of us are here today, so a third of our staff is here today. So we have a strong communications and public engagement team, 2 folks working on research and policy analysis, and program implementation is my area, and then some corporate support and administration. So we say a lot. We have a small amount of people, but we say a lot of things. I just want to talk a little bit about how we sort of evolved to focusing on the patient experience. We started out after our reorganization in 2007 really looking at models of integration in Canada, in the US, and other international venues to try to find out what was working out there, what were the important pieces to integrating the healthcare system. And we learned that the people that are integrating systems well do a good job of handoffs in the system, care transitions. So that led us to that work. And while we were talking to people about care transitions, we found out that listening to the patient's experience in that healthcare journey and the care transitions can really have a lot of influence on the system and the providers delivering the care. So we're focusing on trying to bring that experience to the system and use what we hear from people using the system as a way to improve it. Just wanted to talk about a couple of our products and forums where we've sort of evolved to this area. In integration, in 2008, we did our first integration report. All these are obviously available on our website. This was called Who is the Puzzle Maker? And it looked at patient and caregiver perspectives on navigating health services in Ontario and what the issues were they were facing. Our Hot Talks on Health is a speaker series that we do regularly on emerging topics in healthcare. And we did one in 2010 on the system reforms in the UK. They are also struggling with integration of the system. We also had co-hosted an international forum on innovations in primary care and put out a report called Because This is the Rainy Day, which focused on home care, informal caregivers, particularly dealing with people, seniors with chronic conditions, and how they were experiencing the healthcare system. Those looks at transitions and integration really led us to the patient experience look. So we've, in the last couple of years, kind of taken a deep dive in that topic. The Meeting of the Minds is a discussion forum that we hold periodically on emerging issues in healthcare. It's an invitation-only session where we bring together experts and try to figure out policy issues and make recommendations. We also put out a second integration report called Winning Conditions, and this was fairly recent. You may have seen this or heard about it. And then finally, we had another Hot Talks on Health session in 2012, where we moved from listening to the patient experience to figuring out what people were doing to take that experience and build it into improvements in the healthcare system, which is really what we're trying to do in the PATH project. So that's kind of how we got to our current strategic plan, and the strategic plan is called Hearing the Stories, Changing the Story. And it addresses what we've learned from patients and caregivers in our previous work. So who's navigating the system for them? Is anyone listening? People in the system, as well as the providers, are frustrated with redundancy, repetition, and delay. And we believe that integrating healthcare is the key to improving patient experience. So we want to learn from the patient experience about ways to integrate better. Our strategic plan links our care transition and health system improvement under the umbrella of patient-centered co-design, and I'll talk a little bit more about that in a minute. We hope what we learn from the strategic plan will be used to improve care transition and care experiences, not only in Northumberland, but for everyone in Ontario. We have kind of 4 buckets of work with our strategic plan: research, policy analysis, public engagement, and care delivery redesign, which is where the PATH project resides. So just want to speak briefly about these. The research work that we're doing, we did a health system leaders consultations last winter. We haven't yet produced a report on this because we heard lots of things and we're trying to still sort out the themes. But we asked health system leaders across Ontario about what their perceptions were of patients' experiences with transitions and what they felt the barriers and enablers were to better transitions. We did get some consensus from the health leaders on this. They felt that in transitions we weren't really doing a great job for anyone in the system, not just seniors. They also felt that the quality agenda that we've established through ECFA, which you heard about, is a great place to start. They told us that they think that we should count on the province to set broad direction, but allow local, regional innovation to flourish according to community needs, which I think we heard echoed in Minister Matthews' comments yesterday at the close of the Health Achieve meeting. And that's definitely what we're doing here in PATH, is allowing local innovation to flourish. We've also done literature reviews on how you measure patient experience, and we'll be sort of refining that during the PATH project. And we're currently just finished a community-level survey in this community, in West Northumberland, of patients and caregivers of the healthcare systems here, as well as we're still doing a survey of providers in the area, and that's open till next week, and it's online, so if there's any providers that want to tell us their beliefs and views on how transitions are working and what they think could be done for improvement, that community-level survey is online and still open on our website. The next bucket of work for our strategic plan is the public engagement. And The first piece of work we did on that was seniors consultation throughout the province, and the report we published from that is called Loud and Clear, and that's on our website. And in just a moment I'm going to let you hear from our CEO, Kathy Fuchs, that she couldn't be here in person, just a two-minute video on what we learned in those seniors consultations. And then we've just launched a public citizens engagement panel called Panorama. We just had the first weekend with them, and this is a group of 32 wise Ontarians that are dialoguing with us over the course of the 2 years, so during the same time frame as the PATH project will be going on, about the experiences of care transitions in other parts of Ontario, and we will have opportunities to link what they say up with what we're hearing in the PATH project locally. Stacey's going to help me do the video.
I have been asked as a caregiver, what's convenient for you or a communication problem? So the Change Foundation has been very focused in the last 2 years on looking at the patient experience. When people are moving from provider to provider, those transitions can be tough. So we wanted to speak directly to seniors and their caregivers. We wanted people who had a chronic disease, because they do use the system obviously more than healthy people, and they tend to have to use different aspects of the system. The seniors and their caregivers really can articulate how difficult those transitions can be when they're trying to navigate around the system. And we set up 6 different sites around the province. So we went to Timmins, we went to Dryden, Peterborough, London, Toronto, and we had an earlier exercise in Ottawa. They really valued the ability to share. They really wanted somebody to listen. And they really want to know that the information that they're giving us will be of value for other people. We could put the findings into 3 sort of buckets, if you like. One around connection, one around communicating, and one around inclusion. Providers obviously understand parts of the process when they're responsible for that piece of care, but they don't actually know what happens to the individual when they're moving on to the next stage in their journey. The first feeling was they had a lot of confidence in their healthcare providers. It's not about them. It's a lack of confidence in the system, but it is not a lack of confidence in the healthcare providers themselves. This information will help us in a series of other projects that we're doing, again with the theme of improving patient experience. The big project that we're about to announce in the spring, called the PATH project, is a community-based initiative where providers and patients are going to come together and try to look at those points of transition and fix them. And so the information that we've already got from seniors will be of enormous value. Secondly, we're going to set up a citizens panel for ourselves, for the foundation, of seniors and caregivers from other parts of the province to actually try to help the foundation as we move forward.
So you heard her there say, Kathy say that we're going to announce the project, but obviously we've already announced that, and we're going to be working in Northumberland. So the last piece of work, which is our major investment of our strategic plan over the next 2 to 3 years, is the patient-centered co-design, which is the Northumberland PATH project. PATH stands for Partners Advancing Transitions in Healthcare. The goals of the project are to improve people's experiences as they move in and out of and across Ontario's healthcare system. And we want to do this by engaging and supporting a community partnership. And we're working in Northumberland with the community partnership here. The Change Foundation also wants to demonstrate the value of patient-centered, experience-based co-design for the broader system. So we're not necessarily looking to spread the unique interventions that will work in the Northumberland community, but what we want to do is spread the idea and prove the idea that having patients at the table with providers in co-design can lead to an improved system and is beneficial. The key features of the PATH project are that it's based on experience-based co-design, and I'll talk a couple slides on that in just a second. We're focusing on seniors with chronic conditions. It was very well outlined in the PATH proposal we received from Northumberland. And Minister Matthews outlined this in her remarks yesterday at the close of the Health Achieve meeting, that we know that this population is the highest users, they use the system the most, they use the most system resources, And if we can fix transitions for the high users of the system, it will be better for everyone. We were looking to work with one community partnership. Our foundation endowment is substantial, but not substantial enough to do a deep dive in many communities across Ontario. So we decided to go steep and deep in one community, and we were looking for a community that would bring together a partnership under a lead organization that included patients, informal caregivers, social support providers, acute care providers, home and community care sector providers, primary care, funders and other stakeholders, and mental health care providers. And Northumberland Path Group has done that. We want to focus on the care transitions and the handoffs, and particularly paying attention to how patients are experiencing those. So just a couple slides on what we mean by patient-centered, experience-based co-design. It's really the theory that it's a partnership between patients, caregivers, and staff of healthcare organizations to focus on listening to the patient's experience as they're going through the systems at those providers' locations, and highlighting touch points where they felt confused, neglected, out of the loop, didn't know who to contact. So having patients tell those experiences of how their care journey was will help us focus where we need to make improvements in those handoffs. The emphasis is on patients, family members, caregivers sitting at the table with healthcare providers to redesign a better way to do those care processes so that people don't feel frustrated, confused, or out of the loop. This process also involves systemic evaluation of improvements and benefits. So we will be measuring outcomes for patients, things like how often they're coming back to the emergency department, as well as measuring what their experiences are. And we'll start measuring early on in the project and continue to measure throughout so that we can demonstrate that we've made a difference. Just want to talk a little bit about, this is comments from Barbara Balick, who is a faculty member at the Institute for Healthcare Improvement, which was Don Berwick's organization prior to him working in the U.S. government. She attended one of our meeting of the minds and described to us the evolution of patient experience in healthcare. And we've, for the most part, moved beyond the doing things to patients over here on the left, where providers had all the rules and controls. Patients were just talked to. We didn't really listen to anybody. It was a very unilateral way of communicating. For the most part, most places now, we're in the doing things for patients. So we have some patient and family input. There's a bit of focus on transparency of data on how the system is doing, and improvement focus. We want to make it better for you. But where we really want to move to is the doing things with patients, where the patient and family is the source of control. There's shared knowledge and decision making with their healthcare providers, and they're walking the walk together. And there's a focus on co-designing better ways to deliver care together. And that's really where we're working in the PATH project. So, excuse me, just back to how we got to selecting Northumberland as the PATH community. We launched a competitive call for letters of intent a little over a year ago. We received 27 submissions. Most of the submissions were from communities similar to Coburg, Northumberland area. Received a few from large academic medical centers, but for the most part, they were communities with heart that wanted to work together with their community partners. Some were submitted with a local hospital as the lead organization. Some of them were submitted with a community health center as the lead organization. Others were submitted with a social support organization as the lead organization. But they all 27 proposals brought together an array of partners to tell us why they wanted to work on this co-design on transitions in their community. We reviewed the 27 and created a short list of 5 that we thought were the best submissions and had the most chance for really making this project go. And then we had those 5 communities develop a full proposal. The letter of intent was just 4 pages. The full proposal was, I think, 20 or 15, and it was a lot of sweat, blood, and tears to get it down to that. So, you know, we asked for a budget, and how would you measure it, and how would you recruit patients to work with you, and who would your partners be, and lots of sort of detailed things for a project. And we did site visits, and a site visit really wasn't coming to see a structure, but coming to see the array of partners and how they interacted with each other, and where was the patient focus of the project, because you can't get all that from a piece of paper. So it was very important that we came and did site visits, which we held in this room here. And then we made a final determination in May. And some of these folks are in the room. I see Gail and a couple of Kyle and Robert and Helen and a couple of our partners, and our CEO and board chair. So we had an announcement, I believe it was June 5th. We took a great picture on the stairs over there, leading up to from the cafeteria. And these are the partners. Many of you already know the partnership that's surrounding the Northumberland Path project. Patients, families, and caregivers are right at the top of that. And you see the list of providers, community providers, and community support providers, and the other partners involved. So what was special about Northumberland? Why did we pick Northumberland for the project? I think the biggest reason was we really saw that Northumberland had the patient and family-centered co-design focus at the center of their proposal. They held a series of workshops with patients and families from the community to help them talk about and think through what the transition issues were in the community and what some possible solutions might be. So they worked very hard at that, and when we came to the site visit, aside from the sort of introductory greeting, the first presenter was Gail, a caregiver of patients in the system. And so we really saw right off the bat that Northumberland got where we were trying to go with this project. In addition to that, they put together a very strong community partnership and even added a couple partners from the letter of intent stage to the full proposal stage that strengthened the proposal. It was clear from our site visit and the proposal that improving care transitions is a shared community goal here. You could just see it in the room, you could hear it in the way people talked about wanting to work together on the project. We saw strong leadership commitment and alignment across the community and the whole continuum of care, including support from the LIN, which we didn't see in all the proposals. So that was, we thought, a very strong point in this proposal. They had a solid measurement and data evaluation and data collection plan outlined. And they had an excellent focus on the community issues unique to Northumberland. And we thought those were all components of a successful project. So the timeline from there, we picked Northumberland, announced that in June. Right after we announced it, we made them come to training on experience-based co-design. We brought 56 people together. We jointly sponsored the training with Cancer Care Ontario just to kind of save on some costs, because we brought speakers over from the UK who are the experts in this work. We had, I think, 7 to 10 patients and caregivers at the tables with the providers from Northumberland. So that was great. People just, the ink was barely dry on the selection, and we had a training session. Over the summer, a lot of work done to set up the project infrastructure, convened a steering committee, hired a project manager, designed a strategy to recruit patients and families to work on the project with us. In the fall, we were all fortunate to attend the Patient and Family Centered Care Conference in Ann Arbor, which is an international conference on organizations that are really on the far right-hand side of that patient experience continuum, and learned a lot at that conference. I was fortunate to be able to attend, as well as lots of the folks in the room here. Very energizing to hear what people are doing and what's possible. And I think a lot of those lessons have come back to Northumberland Hills Hospital, not only for the PATH project, but probably for other work as well. So we're drafting project charters for the improvement teams, getting ready to recruit patients, hiring positions to work in the project. In November, we'll start hearing from patients and family members about their experiences in care transitions, what's working, what's not, what those touch points are. And then the project teams will be assembled probably in December, and then the next year and a half or so is really getting together at project team tables and working on the things that will make transitions better. So just a little bit about the future state. So where is all this going? It's clear that there's universal agreement that we need to We need to focus more heavily on patients in our healthcare system. And what we'd like to do with this project is change these stories. So these were stories that we heard during our seniors consultations that are in that loud and clear report. And we have one person that said she called the hospital to explain the problems with the transitions, because it was her belief, and it's ours too, that problems like this and talking to people about their experiences are gifts for improvement. Because it's an untapped resource of information about how well your system is really working. She didn't get a lot of resolution with putting those problems forward. And she wanted to know why there wasn't any clear information about what the next step in the care was. So these are the kind of stories that we want to change with this project. And we want to change them into stories that look more like this. A patient experience that encourages patients' questions and provides them with answers, values their time and their family's time as much as the provider's time, where they're listened to carefully, talked to clearly and respected, accurately diagnosed and comprehensively treated. They get high-quality holistic care when they need it, equip them to self-manage if appropriate, and use 21st century technology to meet my needs. These are comments made that Stephen Lewis, who is a well-known Canadian health policy analyst, made at the Association of Ontario Health Centres conference in 2012. And Stephen has also served as a research advisor to the foundation for several years. So we think the future is here in Northumberland. We think you guys are on the leading edge with the PATH project here. We're going to be focusing on those who need and use healthcare the most. We're going to build on collaboration across all sectors, keeping both hands on the baton during transitions. I stole that from Minister Matthews yesterday. So that you pay as much attention to the handoff as you do to the running of the race. Focusing on improving care experiences in transitions, and most importantly, working in partnerships with patients to design a better healthcare system. Thank you.
Genevieve will now take any questions from board members, if anyone has anything. Okay.
Sorry, just a comment. What really excites me is the fact of moving from really, we've spent a lot of time on patient satisfaction, and we're now moving to the patient experience, and this just makes so much sense, I think. It's going to be, I think, really very exciting to see where that leads us. And my sense is that, patients may want less than what we've been providing. We've provided a lot, and we've been terribly prescriptive, but perhaps that isn't really where they want it to go. And that's going to be very interesting to track.
That's a very astute comment. I think we heard that at those of us that attended the Institute for Patient and Family Centered Care conference. We heard it from the patient panel that they had, speaking to an audience of 500. We heard that in our seniors consultations, that they just want what they need. They're not asking for a ride in a limo, or the newest flat screen computer at their home to track their stuff. They're just asking us to respect them, provide what they need at the right time, and listen to them. So that's been true in a lot of cases where we've actually, people have opened up and taken the risk and said, let's ask patients what they want, because they often don't ask for more than we can provide, and sometimes we're giving them more than they really want. So that has borne out in lots of other work, people that have gone down this road, so I suspect we may find that here too.
Might there be any other questions? Or
This is so exciting, and I apologize. My voice is worse than it was yesterday. I wonder if you can talk a little bit about how you'll know it's working.
That's a great question. I've been noodling with Wendy, the project manager who's back there. We have a research group on the team as well as folks with quality improvement expertise, and any healthcare quality improvement process, we're going to establish measures. And some of them will be high-level outcome measures, such as how many times did the group of patients have to go back to the emergency room because things didn't happen right. And we'll also be measuring, asking about their experiences, and did they feel like they had everything they need to do the next step? Did they feel like they understood? So we're going to be measuring that with a pretty slick technology system where we're going to be able to collect real-time data as they're going through transitions. So we will have measures throughout the project, both high-level outcome measures and process measures on sort of the smaller details of the work that's being done. So that's definitely a big part of what we're trying to do, because we want to be able to show the evidence that it worked and not just have a feeling that it worked.
Anyone else? Well, Genevieve, thank you very much for your presentation.
Thank you very much for your time.
Those of us who live in Northumberland or have lived in Northumberland for any length of time know how special a place it is and how involved a community it is. And we'd like to just take this opportunity on behalf of the board to thank the Change Foundation for selecting us. Thank you so much. You won't be disappointed. Now I'd like to take the opportunity to welcome our special guest, the Honorable Deb Matthews, to address the board.
Well, thank you so much. I will keep this short, but I have so much I want to say. The first thing I really want to say is congratulations. You are the community of all the communities in this province that was selected for this remarkable investment. It happened because you work as a community, and I just want to say congratulations. I want you to know that the whole province is watching, so not to put pressure on you, but we really think you're onto something. We really do think that we're all collectively going to learn from your experience. So, as I say, not to put pressure on, but you are demonstrating, you've already demonstrated that you can really, when a community comes together and gets out of the little silos in which most of us live and work, you can work magic. So congratulations. You know, I've been watching this hospital because you were in the news a while back, and I just can't say how fantastic it is how you've been able to drive change here. ALC rates for me is something I watch closely, because if we've got a patient in hospital who shouldn't be in hospital, we're providing the most expensive care and not nearly as good quality care as we should, right? Because if you're not in a hospital, you shouldn't be in a hospital. If you don't need to be in a hospital, you shouldn't be in a hospital. So I'm constantly scouting the system for areas where I think we can do better. And ALC for me is one of those areas. It's not that we're not spending enough money. We're spending lots more money than we need to be. So you've demonstrated your ALC rates have gone from north of 30 on a pretty consistent basis to now you're in single digits, and have maintained that for quite a period of time, which tells us it's not a fluke. So again, thank you for leading the way and driving the change. You can only take ALC rates down when you've got a really robust community partnership. So congratulations on that. I'm so excited about where healthcare is going, because I do think, I did make the analogy yesterday about about and please, that's the most sincere form of flattery. But if you do think of our healthcare system as a relay race, people who are relay racers practice running fast, and they practice passing the baton. So if you think of the patient as the baton, I think we're pretty good at getting even better at running fast, improving quality within a setting. But where we have so far to go is figuring out how to pass that baton. So I think that's exactly the sweet spot of this project. I think the focus on people with high needs is exactly where to go. I was pretty surprised when I saw some data from ISIS recently. The top 1% consume 33% of our healthcare dollars. The top 5% consume 2/3. So 95% of us are using 1/3. And think about the healthiest 50% of us. So the healthiest 50% of us consume only 1% of healthcare dollars. So if you want to go to where, as they say, if you want to go fishing, go where the fish are. So there's no question that we can do so much better for those people who are high consumers of our healthcare resources. So we can absolutely provide higher quality of care, and we can get better value for money while we're doing it. So I'm not going to take more of your time. I'm running out of voice. But I just from the bottom of my heart wanted to come and say thank you to the whole community for really rallying around this extraordinary community initiative. You are leading the pack. You're going to teach the rest of the system how to do it. But the first step is developing that trust between each other. I think you've been able to already do a lot of that, and I'm sure you're going to get even better at doing that. So congratulations, you are all rock stars.
Thank you so much for your very, very kind words. We have an excellent staff here with excellent leadership. We know it very well. But as I said earlier, we have a great community. And when this community decides to get behind something, it'll make great things happen. So thank you again for coming and sharing your time with us. I hope your sore throat is starting to be on the mend. You're in the right place to get things fixed.